The new Eastern Cape Health MEC Ntandokazi Capa has visited the Maclear Hospital in Nqanqarhu following the allegations of poor services and lack of medication. There are 16 clinics that feed the hospital, including those in Tsolo. Residents allege they spent hours in the hospital without getting any help. The MEC also confirmed an allegation of a rape incident inside the ward at this particular hospital. Our reporter Nomzwanele Mngoma has more for us.
We are at Maclear Hospital, which is one of the hospitals that were highlighted or are highlighted as one of the hospitals in the Eastern Cape that have poor services. And when we spoke to residents, when we came here before, they did mention that it's common for them to come to this hospital and not receive any help. And it's common for them to come and not get medication. But after that, the MEC decided to visit this hospital just to get more information of that. The new elected MEC for Health in the province, Ntandokazi Capa, will tell us more about this story. Ma'am, greetings and welcome to the SABC.
Thank you very much.
Ms. Capa, there are allegations, residents, especially in Ugie, where there's not even a hospital, they come here. They are alleging that it's common for them to come to this hospital and not get help or not get medication. And there's also an incident of a parent that brought his son here and was ended up taking his son because he was not attended to and he was told that there is no doctor.
Thank you very much for that. But from where I am seated, and I have met with the CEO in relation to the incident that you're talking about, I looked at the file, and the file indicates that the patient did receive attention, all the necessary attention. It's the only thing that we realized was the fact that there was no proper communication between the parent and the nurses in terms of understanding what was type of treatment that was given and what is it that they must expect out of the treatment after how long. So I think that's the only issue that is there. But in terms of receiving treatment, they did. The records are in place. And secondly, the doctor was available on the 30th, on the 31st, and on the 1st. So there is. I don't think it is correct to say the doctor was not available. Even the CEO, as you will speak to him, was a doctor on call and did attend to the matter. So it's not true that the doctor was not available. But the issue of you wanting a hospital, it's a matter of us as communities not understanding that we have budget constraints. You can't have a hospital in Maclear and then 20 kilometers away from here you have another one. It is not practical. But the only thing that we can do is to make sure that they have a 24-hour clinic in Ugie so that they are able to get some services without coming to a hospital.
Speaking about clinics, they are complaining that those clinics that you're talking about, MEC, they are very small. And this hospital, 16 clinics refer patients from Ugie here in Nqanqarhu and some parts of Tsolo. 16 clinics, they refer their patients to this hospital. And we heard that there's few doctors. I don't want to mention the number. There's few doctors, meaning a shortage of staff. How are you going to resolve this issue of shortage of staff, especially from a hospital that services Nqanqarhu, Ugie and Tsolo?
Remember, I said to you earlier, what is important is for me to get inside the department because I am relatively new. I only came in on Friday. So I still need to meet with everyone in the department, even the stakeholders, so that we sit, plan, and have a clear understanding of what is it that we need to do. But from where I am seated, from 60 kilometers away from here, there's another hospital, which is Taylor Bequest. So we are trying. And again, an hour from here is Umtata, which is a referral hospital. But we must also understand that Joe Gabi is more of a periphery area. Hence, you would find that there are quite challenges in terms of referrals. Because remember, our system must first get to a clinic. If there's a need for you to be referred, then you get to a regional hospital. If there's a need, then you'll be sent to Nelson Mandela. So those are the challenges that we are facing. But one major issue that we have as a department is the issue of budget. And remember, we half of our budget, it pays salaries. And again, we still need to address the issue of medical legals, something that is a national issue, and there is a plan at a national to deal with such issues.
Lastly, MEC, the issue of security in this hospital. There are cases, not one, cases that residents are alleging have happened in this hospital, cases of rape. And we spoke to one parent who also alleges that she brought her child here in 2021 who had an accident, but at night she was raped. And she believes that if her child was not raped, she wasn't going to die. Any responsibility? And she's also alleging that the hospital did not take any responsibility on that.
As I have already said earlier, that I'm relatively new, but I spoke with the CEO about one incident. I do not know of any other allegations. I know of only one incident, and in that incident, the doctor, the CEO, managed to call police, and the suspect was apprehended. And then the patient was here, because it was a motor vehicle accident, was hit by a car. He had to be transferred to Nelson Mandela. He was transferred to Nelson Mandela, but unfortunately, he immediately passed when he got into Nelson Mandela. But in terms of us taking a responsibility of making sure that the incident was reported and police came in, I think we did that as a department.
Did you make any communication with the family regarding that incident?
Hence, I have said to you, it's something the CEO is going to talk to you. Okay. Will be able to really, because remember the incident happened in 2021, now we're in 2024. But as a department, I do believe that we did play our part, but the CEO will be able to elaborate on the incident because he was part of what people were at the hospital at that particular time.
Nqanqarhu. That is the MEC of Health in the province, just telling us about the engagement that she had with the district director and the CEO and other members of this hospital, and saying that they are going to take responsibilities or have strategies in place to ensure that they resolve these issues that are raised by residents in this area.